Good morning, dear Chairman, dear colleagues. This is Jiancheng Zhang from Beijing, Secretary General of ASAMI China. I'm very glad to be invited as speaker of COCOS. Because of COVID-19, I can't to travel to UK to meet all the best friends. Firstly, permits me to say many thanks to Professor Hamad Sharma and Professor Kuwait, Professor Omlahati, and Professor Duray Nagam. In this session, I would like to show my experience about treatment of diabetic foot using bone transport. I come from KIMS and PUMC. This Professor Qin, he is the president of ASAMI China. He has a lot of experience about deformity correction and limb reconstruction. So, as you know, this severe condition is diabetic foot. Usually, the incidence of diabetic foot was 15%. Foot infections are 10 times more than non-diabetic individuals. Diabetic patients take account 60% among non-traumatic lower limb amputations. So, what's the pathology? We usually using the neuropathy, atherosclerosis, and metabolism and biomechanics to describe. What's the symptom is 5P, swelling, pain, numb, coldness, and very uncomfortable. Usually combine the cardiac failure or renal failure. For the treatment, the article of the license says that a lot of mice can be choose antibiotic and wood dressing, total casting, and hyperbaric oxygen, a negative prior, and some other treatment. Even that, majority patient must to face amputation. Yes, it's terrible. For our method, we call the TTT is tibia transport bone transport. What's the TTT? What's the possible mechanism? What's the indication and the contraindication? So, firstly, I would like to show some cases to describe. Case 1. Male, 46 years, with 5 years of the DM. So you can see the right foot with severe ischemic pain. We're using the simple method so you can see improved. The second day, painless. And during the treatment, you can see improved significantly. No pain and at 2 months post-operatively. Case 2, 58 years male. Even this small ulceration can't heal even the many treatment. So using the simple fixator method we got, good result. So this case 3, male 50 years old, 11 years history of DM. You can see here very bad things, necrotic and ulcerations, very bad, very severe conditions. You can see 15 days later and 30 days later is better and better. What's the method? Yes, just have a window on the tibia, proximal, middle, or distal, no problem, and distraction with fixator gradually. We can got the blood supply advanced coming. So how to osteotomy? Previously, we do the open way. Nowadays, we usually do the percutaneous way with the simple tools. The bone transport usually like that. Firstly, we have the bone cortical bone, and distraction in this direction, and in this way, with the speed of 1 millimeter per day with 7 days, and stop. Stop for 3 for 5 days later, and backward to the original place. Just like the accounting technique. So you can see the X3 during the distraction, we can got the so many blood supply coming. So this X-ray shows the bone window. So and with the fixator, simple fixator, we can got the bone formation and the formation of the blood vessel. For the apparatus, previously we using the ring fixator, but nowadays we have some modification using the unilateral apparatus. Different company we using different color apparatus, so you can see different one was a possible mechanism. Ididanov technique. Yes, the tension low and stress. So just published his principle in the Springer book. So some famous pictures can show the longitudinal distraction and the transverse distraction, the newly formed capillaries, and so you can see the so beautiful bone formation, yeah, on the picture after the bone transverse bone transplant. You can see. Usually we called previously the technique is original or classical error, but nowadays we would like to call the post error of Ilidanov technology. That means we got the microcirculation formation after the bone traction. Yes, we must don't forget the professor saying infection can be born in the fire of bone regeneration. No circulation, no generation. So in this processing, we can get the magical effect of Ilidanov technique in the diabetic foot. It's significantly improved the ischemic condition and obviously improved the self-healing ability of the wound. I would like to show another case. So compare pre and post operation. So you can see, and based the CTA image, you can see the blood vessel, the circulation significantly improved. Another case, so severe, and 3 months later, and we can compare the angiography pre and post operation significantly improved. Another case is bilateral case. So you can see right is more severe, the left side is mild. We can find strange things. We just performed the surgery in right side. The left side is better and better after surgery. Why? Based on some basic research, we found in this processing, we can get the blood supply enhancement, and then maybe this processing has the process of the stem cell. Yeah, some this kind of things occurred. And finally, I would like to discuss the indication and the contraindication. In this severe case, you must say amputation, no need to discuss. But we use this method, yeah, no recurrency, 3 years follow-up is good result. And another one is also the severe one. We can get good result. And another case is 80 years old with cardiac failure and so bad things. 12 weeks later, yes, is good result. Another one with the result 4 months. You can see previously and gradually, finally like this. Another one, 7 months history for treatment. So you can see pre-surgery, you can see so bad. And finally, looks good. So another case with 3 months treatment history, you can see after several times debridement and the combined the method of TTT, finally the result is good. So we also have some complications, fractures on the orthotomy side. We need to alignment after you're also using the fixator. Yeah, the result is good. And another complication is necrosis here, and another one is amputation. So you can see this case so severe. We firstly performed the surgery in the left side, and 3 months later we performed the surgery right side. Finally, right side improved, but left side is amputated. So we have the special society on the diabetic foot illegal technique. It's established in 2019. Yeah, 50 members around the China. Yeah, we have the multi-center analysis in Guangxi and the Mianyang Center. Totally, we have maybe more than 500 cases. Totally, the effective rate more than 90%. So it's a very amazing result. So I would like to discuss the indication. The doctor and the patients must understand that this kind of technology. No palliative atherosclerosis obliteration is an indication. Even the condition of the diabetic foot is seriously. The CTA is a method, but it's not the God method. We would like to propose the DSA. And then no relationship with the Wagner classification, and blue tor syndrome is contraindication, and advanced age, gangrene and severe pain is a contraindication, and combined uremia is a contraindication, but now they changed. And finally, is blood sugar less than 8 more before meal is not a contraindication. Just mean even the blood sugar uh, can't be controlled. We also can select this method for treatment. So we just discussed what's the TDT and the possible mechanism, and what's the indication and the contraindications. So conclusion, the TTT technique, this method is effective and useful on diabetic foot with authorization. Even it's a new one, but maybe it's not the best. It's effective and useful. This surgical method is a simple one and a mini invasive procedure, and the rate of amputation of DM can be reduced significantly. So finally, I would like to invite all the friends to take attention to the sixth World Congress of Asami and ILAS and BR. This will be held in Beijing 2023. What a joy is to have friend coming afar. Is famous Chinese person says that. This is my email box. If you have any questions, to send them to me. And thank you for your attention.